Good afternoon. I'd like to welcome you all to the May 13, 2013 meeting of the Pitt County Division of Social Services Board. I'd like to take a moment for silent meditation or prayer. Okay, thank you. Well, we're adding something new today. This is the first time where we're having public comments. And do we have people? No one for public comments. Okay. As you know, we've installed this to allow the residents of Pitt County to address the board, and we heartily hope that the residents take advantage of this. Okay. I'd like to get a motion to adopt or revise today's agenda.
So moved.
Second.
Okay. Motion has been made and seconded. All those in favor say aye.
Aye.
Okay. I'd like next to look at the minutes of the previous meeting. I'd like a motion.
I move to approve the minutes as mailed, Mr. Chairman.
I second that motion.
Motion has been made and seconded. All those in favor say aye.
Aye.
All those opposed? Next, we'll move on to the status of agency personnel, and that'll be by Director George Perry.
In the present time, we have 14 vacant positions within the Pitt County Department of Social Services. We have 5 positions that have been frozen. We're in the process of interviewing for some, and we have filled 5 positions since our last meeting. So you can see Naomi transferred, Pamela Ellis promotion, Daphne will join our staff, Tricia Jones will join our staff, and Tanya Dawson is a transfer. So we have making progress. We have 5 that's frozen at the present time, and they will be released after the 30 days of time period.
Well, that's really good, and one of the things that we had talked about, and I'll just refer the board members to the notice about files since last meeting. You'll notice that these are all transfers, so that means they'll be up and running a lot faster, and there'll be less time for training and other things that would slow down the movement into new positions. So you're saying after 30 days, the other 5 positions will be unfrozen?
It depends on each one. He looks at individuals, so 30 days from the date that the position became vacant,
Okay.
then whether or not there are personal leaves that will pay out, so then you add all that, but we're looking at 30 days from the time that the position was left
Okay.
vacant.
Okay, and again, we really appreciate this because we're able to keep a better track of the hirings and things of that nature, how we're handling vacancies. You were going to say something, Mary?
I really like it when there are internal promotions. I think it's good for morale.
We try to promote in-house as much as possible.
Thank you.
Next, we're going to move on to P.J. Quinn, Business Officer.
Yes, sir. We received $370 from the State for Progress Energy, and we also received $7,200 for the Adoption Promotion Fund due to Miss Mildred's work having more children adopted than the baseline. So another $7,200 coming in this month.
I had one question about the Energy Neighbor Fund.
Yes, sir.
Now, that money goes into a fund to help the residents. Now, as I understood, that time was over, or this is extra money, and how would we dispense it?
This is not the Greenville Utilities money. This is money that comes from Progress Energy, and it's used to help the staff, and it runs all year.
It's used to help?
I didn't mean staff, I meant clients.
Okay, so there's still ways that they
It's-
can do
yeah, it's a
that?
very small amount. I think the total we've gotten so far this year is like $5,000.
Okay. And how would they apply to that again? Or for that?
They will use the same process that will come into Pitt County Department of Social Service Human Resource Center, and they will make an application. They have to be receiving their utilities from that company in order to qualify.
Right, because I had been seeing, we had been getting small amounts all the time, and I just wondered how that was dispensed. Okay. Yes,
And I know Mr. James has asked before about some of the local, other than GUC and we see Progress Energy now. And they have, and some of the other electrical have not offered anything, I believe, historically. And as we change from water corporations and that because these people also use those, do we ever get any help from these water authorities or water boards?
The only people we've gotten any money from outside of Greenville Utilities is the town of Aden.
Okay.
Because you got debt cold.
You've got Isco Martin, you've got
REA and Palmer?
DSS Board.
They did send letters out to all of the utilities around, but the only one that responded was the town of Aden.
okay. Okay. All right, I'd like
Thank you.
any other questions? Okay. I'd like to have a motion regarding these two issues.
Move it.
I'd offer a motion that we accept as presented these two monies coming in for the use of client goods.
I'll second.
Motion has been made and seconded. All those in favor say aye.
Aye.
All those opposed? Motion is passed. Next, we move on to daycare amendment to local policy, and that'll be by Margaret Dixon.
On your agenda, you'll see page 13, but if you look in front of you, you have a handout that's more current on this policy. There's a letter from the Division of Child Development and Early Education. It references the fact that the division allows local purchasing agencies such as ourselves to develop local policies that cover certain issues. We've attached to that, you will see we've made a change to our local policy number 8. And if you remember, we've been kind of touching on this since we had a reduction in services around 8 and 9-year-olds. Our waiting list stays around 1,400 at this point. So that Raleigh has approved our amendment. Basically, what it says is that we will no longer serve 8 and 9-year-olds as long as we have a waiting list. What we've opted to do, though, is to not put this in effect until school starts, which means any children that turned 8 up until school starts will get daycare this summer. They will not be terminated until school starts. And then, once school starts, any children that turn 8 will no longer get services. Okay. So that's in front of you for your consideration and approval.
Mr. Chairman, I move that we approve what has been presented.
Did you have a question, John?
Yes, the funds that we receive for this will cover, I'm sure, Margaret, through this summer, just so the record that we're not producing any special or unknown funds. The funds that we currently have for this use will support what this amendment is asking,
Correct.
waiting until there. Only question.
I second Mr. James' motion.
Okay. Why don't you make that again?
Yes, I move that we approve the recommendation that has been presented by Margaret Dixon from the State Department. I guess is what it is.
Correct.
And you second that?
Yes.
Motion has been made and seconded. All those in favor say aye. Aye. All those opposed? Okay, that has been passed.
And that's there for your signature, too.
Okay. Glad you found out, Charlie, that we have money to cover that before I signed this.
Well, this has been,
Yeah.
as we know, a very controversial subject, even up here, but it must have certainly been for parents as we had to cut back, and how did we cut back, and also, if we say, well, we're gonna hold to them, to somebody that might sound like, so I wanted that clarified for our audience.
Margaret, there's no prospects now that this money will be reinstated or anything pertaining to that for the 8 or 9-year-olds as time goes forward?
Well, the money that we get, we've looked very closely at what's proposed to be given up to us this coming fiscal year. And of course, there's the state budget to go, and then there's the federal budget to go. Usually, we don't know the bottom line in a true allocation letter till late August, even September. But based on what it's been proposed that we get, we feel like we can go through the summer, but yet again, we know we have work first clients to serve.
Yeah.
We have others on the, on our targeted waiting list to serve also. And with 1,400 on the waiting list, we feel like this might be a good approach because we're very top-heavy now in preschoolers. I mean, there's many, many children on our waiting list that are birth to a year up through these age groups, so that are just sitting there on our waiting list.
So you're informing the daycare centers that the chances are these will not be, they will not.
A
That's
letter
good.
will go out with this check this month, and they will know, because some of those 7-year-olds had vouchers that terminated at the end of May, so now they will know that they're going to be extended until school starts.
Right, okay.
And that's really good to let them know what's going on.
Yeah.
My assumption is that some of the riders are not as happy about this.
Your assumption could be correct.
No doubt about that.
Could be correct, all right, okay. Well, we'll move on to House Bill 971, and again, that's Margaret Dixon.
I just wanted to bring your attention, and you have a copy of the bill in your packet, and I'm asking for the board, if you've had a chance to look over, I'll just go over the highlights, asking the board today for Dr. Hamilton to sign a letter of support to send from our county, from our DSS board, stating that the department is in support of House Bill 971. And before I forget, Representative Susan Martin, who is one of the sponsors of this bill, has tentatively agreed to come to our next board meeting to really talk more in depth about the bill and the funding issues. But this is an act establishing Family for Every Child foster care initiative to improve permanency outcomes for children in foster care. This House bill would create a Permanency Innovation Initiative Fund that will support a demonstration project with services provided by Children's Home Society of North Carolina to improve permanency outcomes for children living in foster care through reunification, to improve engagement with biological relatives of children at risk, in or at risk of entering foster care, and reduce costs associated with maintaining children in foster care. And in implementing these goals, the fund would support the following strategies. 1, family finding, and as you know, we are a family finding county, okay? And I'll just remind you that this is a program that uses intensive biological family engagement services to discover and engage biological relatives of children living in public foster care, to provide permanent emotional and relational support, including adoption, legal guardianship, or legal custody. And the second goal would be a child-specific adoption recruitment services, which follows the Wendy's Wonderful Kids model developed by the Dave Thomas Foundation for Adoption, and works with children in public foster care to develop and execute adoption recruitment plans tailored to the needs of the individual child. Okay, so that's kind of the highlights of this bill. I think it's very important legislation. I know that there's will be a lot of discussion in committee around how to fund this, but I feel it's something that we should support.
Mr. Chairman, I move that we support.
I second that.
Motion has been made and seconded. All those in favor say aye.
Aye.
All those opposed?
That's pertaining to Bill 971.
Right, yeah. I would just say, I think this is, I really like that we are getting behind this type of bill, because I think that shows some of the proactive nature of various boards as well as you guys over there on the other side, that sometimes we got to push a little bit and show our support of things and be vocal. So I
And
appreciate
what's
that.
I wanted to commend you for doing this, because this is one of the kinds of things that come up on the regional meeting, the statewide meeting, and it's good to know where the counties stand on bills as they're presented. So I think you were great in that.
And I'll be signing the proclamation.
If you've
Okay.
got one there.
Mhm.
Okay, great.
Next, we're moving on to reports to the board, foster care, and Mildred Daniels. You come here so often, I think we're gonna put you on the payroll or have you up here.
That would be a wonderful thing.
Okay,
Good afternoon, everyone.
remember that now.
And
She's on the payroll.
Oh, that payroll.
I'm on one payroll. He's talking about putting me on.
Put you on a couple, you have a lot extra time.
That's what you get, thank you.
And first, let me say that I thank you, Dr. Hamilton, for signing the proclamation. That was one of the things that I was going to mention. So to lead in, May is National Foster Care Month. We started out with March being National Social Worker Appreciation Month, and this agency had a big celebration for that to show the appreciation for all the social workers, not just the ones that we may deal with in child welfare, but also the ones in adult services as well. And then we pulled up April with Child Abuse Prevention Month, and we did, make sure that we put the word out in the community to promote, preventing child abuse. And so now we come to May, which is National Foster Care Month. And we started ours off with, making sure that we could get the proclamations from the county, the city, and, most of all, our DSS board. One of the things that we did to kind of kick the month off with was to do a walk. We did our first walk on Friday, and we have our little trail that for each month that we celebrate, we have our little trail that we walk, and wear our T-shirts supporting that we, take care of kids, because that's our job. That's what we all come to work to do. We're charged with that, and we like to make sure that we express to the community that we are fulfilling that. We are looking at having our second one, which the committee, Ms. Chandra Mewborn and also Ms. Jasmine George, who are with us today, we're looking at them coordinating a second walk that we're going to have that's going to pull in more of our community partners. So we want to have that one down in the courthouse area and involve our judges and our Garnet Lighting Program, who, are so strong with us and they're quite passionate with the things that we do here at Social Services with our children. And today, to highlight our month, we just want to highlight one of the things that we have going on, one of our newest initiative, One Child, One Church initiative. And we have 3 major churches. When we first started this, some years back, we sent out letters, and we had 3 of the major churches here in Greenville to jump on board and have been just sticking with us throughout, and, have been our community partners that have helped us so much. And I'd like to mention and give them the kudos for something that we are very, very proud of, that we started some years back, and then, it kind of fell by the wayside, but it has been renewed. We have a foster and adoptive parent appreciation banquet, because a lot of times we as the workers may tell the families thank you, but when they can see somebody else telling them thank you, they can give them the opportunity to sit back and just relax and let somebody treat them and pamper them. We think that is just one of the greatest things. And, I will say that we had so many wonderful compliments. We had so many wonderful thank yous from our foster parents for that. That was held on May the 2nd. And the 3 churches that did that, it was held actually at Emmanuel Baptist, but the 3 that are involved with our initiative is Emmanuel Baptist, Oakmont Baptist Church, and St. James United Methodist Church. So today, I'm not going to do a lot of talking. But today, what I want you to do is just hear from them, because they are some of our major supporters when it comes to our children. And I want them to just come and in their own way, give just a few words about their involvement with us, the importance of what they do with us, the importance of what we do, and how, with you all's support, we're making sure that we take care of our foster children, and we have to take care of our foster parents, because if we did not have the foster and adoptive parents, who would take care of these children? So we have to always keep that in mind, and we're so appreciative of them, making sure that we do what we're supposed to do. We have Ms. Kim Grizzett, who is with Oakmont Baptist, Diane Myers with Emmanuel Baptist, and Karen Groot, who's with St. James United Methodist Church. So I'm going to have each one of them to just come and in their own way just share some of the things that they may be doing with us.
Hi, I'm Karen Groot, and I'm with St. James United Methodist Church, and our mission statement is to follow Jesus, love others, and change the world. And we've been working with One Church, One Child for a few years now, and just this year, we helped serve at the Foster Parent Appreciation Banquet. We've done cooking classes for the youth that are aging out of foster care. We had a bake sale following that, and the children raised $500 one Sunday, and then they gave it to the younger children in foster care. We connected our Eagle Scouts at church to a project where they built portable bookshelves for the children to take from home to home, and another church did a book drive for them. We have a uniform closet at St. James, so when a child goes into foster care and maybe might be changing schools or doesn't have uniforms to start with, we fill that need. And this year we have a line item in our church budget, so I'm excited about that, and I'm looking to the future to develop a committee at our church, because we have so many gifts and talents at our church, and we hope to teach sewing and knitting and music to the children. And we also heard about a need of two families that were living in a hotel, and over Christmas we gave a wonderful just a couple days' time, pulled together Christmas gifts for 10 different children. So I'm looking forward to expanding our help with One Church, One Child, and raising the awareness of the need for foster parents. Thanks. I applaud you.
Hello, I'm Diane Myers, and I'm from Emmanuel Baptist Church. We were asked to share some of how working with One Church, One Child has impacted us. I thank you for allowing us to come and share this with you at this time. When I was thinking about this, there are three major ways that working with One Church, One Child has impacted me as an individual, and therefore as a group, I think we've been able to share this within our churches. First of all, we've met wonderful social workers who are dedicated professional people who spend their lives making our community better by helping children who are in need, who need stability and support from them and from all of us. Because of this relationship, the social workers have begun to contact us as Karen said, when there was an immediate need. And therefore, we can go to our resources, our churches, and ask, and we have been very blessed to receive support to meet individual needs that were needed very quickly. Most of these are for the individual children, but it also impacts whole families. Of course, working with them, we have become involved with working with the children of Pitt County who are in foster care. And our goal is to make their lives better. They've gone through lots of trauma and changes, and we want to show them that people do care, and we want to support them. This has offered an avenue for us to offer assistance and to be advocates for children in our community. Sometimes directly, we become involved with the children, many times indirectly by doing things that help, but we never see the child. it's given me a chance to go back and share with my church, and I'm sure Karen and Kim have had this opportunity in their church, to make our churches more aware of what is needed from us as caring, supportive people in this county. Finally, we have become involved in working with foster parents, people who offer so much, who give their love, their home, their support to the kids of our community. And we know that the more stable a child's growing up years are, the better their futures will be. They need to know that we care. Things are beyond their control. We as a community have to support and care about these children. I've been blessed to work directly with one young lady quite a bit recently that has such a bright future, and she's going to be such an advantage for us. She has so much to offer back. We need to assure children like her and many others that we are here for them. Thank you for letting me share.
Hi, I'm Kim Grizzard. I'm from Oakmont Church, and I have had so much fun working with One Church, One Child. I do the fun part. They do the work, and I do the fun part. When we first signed up for this, your wonderful social workers were just good enough to say, well, we don't know everything we want it to be, so sign up for something that you'd like to do. And that was exactly what I did. So we planned just fun activities for the children, and so it's just like a party all the time. And we've had a fall festival, a couple of them actually. I don't know how many we've had now. We've had an Easter egg hunt. We've been fishing at a stocked pond where every time you threw your line in, a fish would jump on it. We've had movie night. We've been swimming. We baked cookies, and kind of one of our highlights has been we got invited to Lake Christie to go water skiing with Christy Overton Johnson, and that was big, and we're going to do that again this summer. So I feel like even though I have 2 children of my own and I'm not a grandma, I get to be like grandma. I get to be just fun and give them all the candy and then send them home. So that's been a lot of fun for us. And what I have found in this experience is that people in this community really would love to reach out to foster children. They don't know how. And so I feel like one of our roles with One Church, One Child is to just tell them that it's okay and that they can do things. And so many people, when I've just asked, have said sure. And I'm not afraid to ask people. So the Greenville Aquatics and Fitness Center let us come in and swim when the place was closed and provided a lifeguard. I mean, they wouldn't do this every week, but all we did was ask, and they said sure.
Sorry.
That's okay. And ECU invited us to come over to the Family Fair Series. You know, that's a ticketed event, and I just emailed and said, you know, by the time these families buy these tickets, we didn't do that this season, but we did it last season because there was a production that was going to be of particular interest to foster parents and children. And they said, sure, we'd love you to come. And after we came to one thing, they emailed me and said, do you want free tickets to other things? It was incredible. And just recently, and I'm not a sports person, so I'll get his name all wrong. The strength and conditioning coach? Jeff Connors, thank you. At ECU, who spoke at the banquet, I was playing with the kids, so I didn't get to hear him, but who spoke at the banquet, said to me, he wanted to have the kids come over and watch football practice. And I said, are you kidding? Of course they would love to come over and watch football practice. So, you know, that's something that we want to do. And I didn't look up the scripture, and I apologize for not doing it, but I know it says in scripture that when you have a party, when you have a banquet, you don't just invite the people who are in high positions and the people who can return the favor and invite you back. You invite the people who don't get invited to things. You invite the people who are poor, the people who are needy, the people who are the least of these, and you'll get your reward for that. And that is so true. You know, we are rewarded 1,000 times over. I can tell you, no offense to Coach Connors, and I know he was a great speaker, but I would 10 times rather be eating chicken nuggets with the children than to be at the nicest banquet in the world, because I've already gotten such a reward from that. And one of the ways I get a reward from that is the kids remember. I just saw some of our kids Friday night, and I mean, this fall festival must have been 2 years ago, and it was nothing fancy to begin with, but I said, do you remember me? And they said, yeah, you had the festival at the church. And these kids had just been adopted thanks to the work of your social workers and your wonderful foster parents who want to adopt children. They had just been adopted, and they said, can we always come to the festival even though we were adopted? And I said, I think you should come to the festival for as long as you want to. So we agreed that they would come to the festival. And one of my dreams and goals is for the kids to go to camp together sometime. I mean, we have zero budget, and God has just provided everything we've needed. And so I know one day in His time, He's going to provide camp for these kids. And I just think it would be incredible for some of these children who have to be separated because they can't be placed together in foster care to get to spend some time together at camp and to maintain these ties to their siblings and to just have that time with each other. And so I just thank you for the opportunity and for sharing the children with us. And I just tell you, if you ever want to come and have a good time and play with some kids, let me know and I'll invite you. Thanks.
Wonderful.
Okay, and I'd just like to wrap it up to make sure I don't leave anybody out. I had introduced Miss George and Miss Milborn. We also have with us our social worker who helps to coordinate a lot of the things with the One Church, One Child program, and that's Miss Jennifer Fowler.
Did she stand
she's
up?
here with us tonight. Can all three of us stand?
Okay.
See, we have-
That way we put a name with a face.
Right. And we always have such support from all of our social workers, but those are the ones that could come because, somebody has to be back
They
on
have to
the
work,
job.
huh?
And I'd like to just say that if any other information is desired to be a part of any of the things that we do, we can be contacted here at the agency, which is located at 1717 West 5th Street here in Greenville, and you can call 252-902-1110 or go to our website, and we have an excellent website that speaks to all of what DSS does, and one of those things is our One Church, One Child program. So feel free to gather more information, and we're always available to make sure that the community is well informed of everything that we do. So I thank you for your time.
Thank you.
We really appreciate what you do, and these kinds of things show the generosity, not just in money, but of time of the residents of Pitt County. And what's going to happen, I feel, is that these children are going to understand a lot of things because they're learning about charity. They're learning about helping people from you and from the people that are involved in the One Church program. So really appreciate that.
And a lot of times we do hear from families that say that they have their children involved in things so that they can teach them how to give back, to the community. Okay, thank you.
Okay, thank you. All right, and next we go to Gwendolyn Burns for bid recommendation.
For the upcoming 2013-2014 in-home aid contract year, 4 companies submitted bids. These companies are Action Health Staffing with a bid of $12.42, Addis Healthcare with a bid of $12.35, Health Pro with a bid of $12, and McLeod's and Associate Incorporated with a bid of $11.50. We visited each of these companies and interviewed the management of each company. All 4 companies have the basic structure in place to compete for this contract. Although we feel that all 4 companies could provide appropriate care and services to the clients of Pitt County, after careful consideration, we recommend the 2013-2014 contract for in-home aid services be awarded to Addis Healthcare. Addis Healthcare is the current in-home provider for Pitt County. They are currently serving 53 of our clients at the rate of $12.35 an hour. We have done anonymous surveys with Addis during this year, and one survey was completed in November 2012 and March 2013 with favorable results. And we also did an audit of client as well as aid records on May 6, 2013, with minimal deficits noted. Also, one of the things that we also liked about Addis was that they are continuing to increase their technology, and they're going to be providing smartphones to all the caregivers that will make the agency accountable for outcomes and able to track their outcomes. And last but not least, Addis, as the in-home services provider, will allow continuity of care for the clients on our caseloads, and there would be no change in the current rate of service at this time.
Okay.
I have a question. This is the inclusive of the survey that was sent out of those. How did the other agency do with the surveys? In other words, did Addis get more surveys back in a report than Action?
Well, actually, the surveys were only sent to Addis because that is our current provider of care.
But I see that there were 60 clients in Pitt County in Action, and I was looking for service for Pitt County residents, and you have service by all of these to Pitt County people.
We have service, but Addis is the only one doing in-home services. You look at Health Pro, they have served 50 clients, but none of those are DSS clients. So Department of Social Services client, and McLeod and Associates, I think they have 13, but none of those are DSS clients. So when we looked at it, we looked at whether or not they would be capable, up and running, to be able to serve our clients with no downtime in services. Some of the companies will have to build up their staff in order to take it on. Plus, then they will have to learn all about in-home services, the billing process. And when we looked at Addis, they already had in place the structure. They were already doing it. The survey was good that because we asked the clients that were receiving the service, how was Addis doing? And the majority of them did not have any problem with Addis. And then Addis are moving to more technology so that we'll be able to track when the aid goes in and if there's any issues. So based upon those things, we felt that Addis would be the best choice.
But I guess what it is, when you go out for bids, this company, since they've got everything in place, like you say, they ought to have been able to do it cheaper. And if you don't watch out, how are these other people going to get any experience, I guess is what I'm saying, if you don't ever try them? If they are qualified. I mean, I'm talking about if they're qualified, and she said that they were qualified.
Right. Well, we're looking at whether or not they have the capability to take on our client all at one time.
Yeah.
You know, they're not dealing with any Department of Social Services clients or have any clients from Department of Social Services. So we're looking at the learning curve to get up and running, whether or not that would be advantageous to break the service that we already have in place.
I'm getting the impression, though, that you were going to pick this person regardless. And if I was you and I was bidding for a contract, I expect if I was a low person that you give me. Do you know where I'm coming from? Well, I won't. If I see I'm not going to get, I'm not going to give you a bid.
That's one of the reasons I raised the question, because I noticed the amount of the bids that they all submitted. And if I know that you're going to stick with what you got because it's less change and you're least likely to change when the other one has less bid, which will be cost effective for us, it seems to me that, why would I submit a bid?
Yeah. So I mean, if that's what, I want you to get the best one, but how you going to know you got the best one if you never try them? I learned over the years that people, you don't know.
You not encouraging
How you feel, Charles?
good services from everyone if you get the same one all the time. And I know I'm gonna get it, so I know what it takes to get
They
your
ought to have a
business.
cheaper price.
Charlie? John, go ahead.
All right, thank you. Mr. Eugene asked me what I think. I said, yeah, give me a chance. All right. I guess one of the questions, feeling some of the same things, I can imagine that, and there is a strong value to our clients for the continuity and not having a major change. I certainly recognize that. That a stronger reason for me than maybe, and I don't know what value, but then maybe 20 cents an hour or something like that. But it does beg the question when we do a bid, how does anybody, or is anybody going to get the opportunity ever to really be a bid? And if so, if we look at it, not for this bid and not as an upset to this or a change in this, but as we go forward in the future, would we want to divide our number of clients in half and have two? Or do we want to take some portion of new clients and have a bid that we tried? Because if you were in their shoes, you could imagine, and not whether I'm even willing to put in a bid or not, but you could imagine if we do this numerous years, that they've got their group that they like, and they're going to stay there, irregardless of the money. So my question, although it sounded a lot like both Ms. Perkins and Mr. James, but my question would be, how in the future, is there any way that it could be made to be more inclusive? Some new clients, the next 20 clients, but a bid that comes out that way, which gives somebody chance. If I heard correctly, part of the justification was obviously continued, and I put a great value on that for the existing people. But part of it was whether they could gear up. Well, let me ask, won't they be in the exact same thing next year when we do a bid? What's going to change?
Gonna be the same.
I mean, unless they have gone out and gotten, in other counties, become lead agencies for all of this. And if we say that is preferred, then wouldn't we want to put that in our bid? That if you've been a lead agency in other counties or in here, that those items will be preferred. You know, you'll see job applications that say so many years experience, here's the education level, but so many years experience preferred. In fairness to what we're asking them to do, I guess I would put on the table, could we look at it for another year and say, how do we do that? Because it feels, and I don't know, and I'm not questioning any of you all who made the intricate judgments, but it feels exclusive
Couldn't you
of a lot of people.
divide the,
I guess one thing is that.
I don't know the way.
Yeah,
I'm just
and I kind of see your side, but looking at it on the other side, if they've been providing a good service,
Yeah.
and they've been doing these things, and the surveys have been positive, then in a sense, we would want to keep them, and we may want other people to come in, but then in a sense, would it not be on the other bidders, on the other bidders to show how they could do a better job?
have we tried anybody?
But they already
that's
said
right.
they
I'm
already
glad you
said
did.
They all
Yeah.
qualify.
I'm glad you present that, Dr. Hamilton, because that's both points.
Yeah.
We are discussing, we're neither criticizing one or the other now. So
Before
that-
we moved to Addis, we had interim health care that was provided this same service. So in the last 3 years, we have made changes in who the providers of this service is. Interim, Addis, Action Health. Staffing was on it before, sorry, but I thought it was, but Action Health Staffing had the bid before. And Addis have only been doing, this will be their third year. So we have in the
But I-
process,
that
made
makes a difference.
changes based upon the same.
I would
But,
just
yeah,
like to add,
go ahead.
though, that, these are performance-based, too. We look at the performance, we provide you with surveys that are done, and to the board about how their performance is. We provide you with any issues. I mean, they're,
Are they the high bidder?
No, they're not.
No, they're
They're
not
not.
the highest, but
1235.
they are more than the lowest.
Oh, they were the second highest.
Yeah.
I don't know what other companies, and I like their, there's nothing to say that you can't do more than two companies or, spread the business around.
Is it a better advantage for you doing one company rather than splitting it?
Well, if you got
For
bid,
many
I think
reasons,
you
yes.
lose. I don't care what.
You see,
But I guess it's sort of like any business, I'm sure the hospital, the county, by
We
law,
take the
you have to
lowest.
put it out for bid, but you
take
tend
the lowest
to.
guy.
Yeah, we are
Take-
gonna take bids.
What reason, unless you're just strictly saying, we're gonna go with the lowest bidder no matter what?
how much money you save if you go with the lowest?
As far as the differences in the bid, probably not much.
85 cents.
How much, I think what she was asking, what does that convert to in a year or 6 months? How many more people would be
They could serve one client more if we went with the
25,
lower.
10, it's 35 cents.
So you can serve one more
Oh, I
person.
don't know.
Yeah.
But that's not, the point of it
I
is, when you got a
understand.
bid, that's my philosophy, when you got a bid, you're
You go with
bidding to
the
get the
bid.
lowest bid. Our policy is, if they're all qualified, the same. See?
They all qualify, but we're not going with the lowest bid.
They all qualify,
Yeah.
but then, but
Yeah.
I guess the difference is this one has some years of experience
That's
with
it, right,
providing
yeah.
service.
That's the thing that,
And that's.
And we
it.
can't,
And I'm thinking that's positive. You're thinking that maybe we should give other people the option to get
Opportunity.
involved. in
Well,
it.
how you gonna ever get anybody else? This company is going, they ought to have been cheaper because they already
they
set
already
for it.
set.
No, maybe not.
Yeah.
Maybe not.
cost-
I mean,
Maybe I
because
know
they're-
I'm gonna get it too, you know that?
No, I'm saying maybe not. Maybe that's why they're able to do this. And the other company, and I'm just
Well,
speculating. Maybe not.
I'll
But
let
I was
you
gonna
make
ask
a
one
decision
question.
on this.
How did you guys come up with this
Make a
decision?
decision.
What was the meeting, not the meeting like, but how many
Oh, do you
people were
wanna say
involved?
anything?
How was it done?
Paula is our supervisor of in-home services.
Oh, okay.
So, she may have some
Okay.
light to shed on this also.
Now, who is this?
Paula Meek.
Paula Meekins, you've met Paula before. She's our supervisor of in-home services and CAP. And guard, and many
Yes, I've seen her
guardianship
there
cases.
before.
Yeah.
How are you?
Good, how are you?
Okay, aren't you glad you came?
We'll see.
Sorry, Paula.
Okay. All right.
Okay, basically, I guess how we came to the decision is when you're dealing with the elderly, disabled population, they don't do real well with change. They love continuity of care. They're used to seeing the same aides go in their house every day. Some of them do not even want to take fill-ins. When their aide is out sick with a family member or whatever. They're very familiar with the staff. Donna Adams is the RN that goes out and visits them at least every 90 days. They have office staff that, they're familiar with. They're used to these faces. So we really do feel like the continuity of care played a very big part. If you'll look at the end of each paragraph, as Ms. Dixon was saying, the bid, you wouldn't be able to serve but maybe one more client. We have used ANIS. Things have been going well per surveys. We meet with them monthly to go over what's going right, what's going over wrong. We discuss that. ANIS has their aides in place to work with these clients, so there's really not going to be any change that we're going to have to go through. With some of these companies, they are smaller companies. Yes, they do work with clients. They work with CAP clients here in Pitt County. I do want to mention that, but are not in-home aid providers. So they don't have the experience. They are not familiar with the in-home process, the bidding. For an example, I believe Health Pro, let's see.
They're on here.
they're currently serving 50 clients. They have 46 staff members. McLeod's is only serving 13 clients. So in the next 4 weeks, they're going to have to get additional staff. They're going to have to hire additional staff, probably additional nurses to come in and help get this process up and going, because it is a very detailed process that we have to go through, not only our social workers here, but also with the company that gets the bid. So there was a lot of thought put behind it, but I guess the basic thing is we're serving only one more client with the lower bid. We know this company through our surveys and working with them through the last 3 years. We know they can provide appropriate care and services to our clients, and they've got up and coming technology. We're working with a telephony system that keeps the aides on track, lets us know exactly when they arrived, when they left, so they cannot reduce their time without getting docked pay. We're looking at smartphones, and one of the things that we really liked is the fact that if a client has a condition such as a skin breakdown on their leg, what that smartphone's going to do is the aide's going to take a picture of that condition, and that picture will go directly to the RN, who will assess it and will help make the determination of what needs to be done. Whether or not another aide, the nurse needs to go out there, they need to get emergency care, just what. So all of this played in to our decision. We did not make this audit because the companies are very qualified. Action is very qualified. We worked with them previously, as are these other ones. It's just a long, detailed process with, like I said, our social workers and the facility get it up, and then also we're having to send letters to the client saying, Addis is no longer your provider. This is going to be your new provider. We have to send letters out. We have to go out and get them new, acclimated to the new staff. So.
Question, Mary?
No, Mr. Chairman, based on what I've heard, I think we're ready to make a decision now for the motion that we accept the recommendation of Ms. Bernie.
And I second it.
A motion has been made and seconded. All those in favor say aye.
Aye.
Aye. All those opposed?
I vote no,
Okay.
Thank you.
but that's all right. I vote we-
Did you abstain or?
I voted.
He voted no,
I did
I
all
know.
the rest of it. It's good you can do it. I just.
I was going to,
but you need to be aware of our concern for the
I was
next
going
time.
to add, based on the continued care to the clients that we serve.
Well, see, you don't know the cavities of other people. That's the reason I did what I did. And I don't believe in rubber just because they've got it, give it to me again.
Yeah, I think that what you said was good because it gave us insight into the decision-making process.
I voted no too, 'cause I wanted to send a message to this other people that all of us are not in agreement. Next year, it might make a change on that, what they bid, if you know what I'm talking about.
If they understand that.
That's exactly, they better understand it.
And we're sending that out over the airwaves, so I think it's getting there.
I think so.
Okay.
That's good.
All right. Next, we have NC
You know where I'm
Fast
coming from.
strategic planning update. Brian Everett and Mary Revilla.
And Mrs. Ravilla is a supervisor of Family Assistance Unit, which includes Family and Children's Medicaid and Work First. And she is the project champion for Medicaid, the projects 2 and 6. So she's going to start off, and then I will conclude.
And I thank you this afternoon for allowing me to come and speak to you about NC Fast and what we have done so far with NC Fast and what we're planning on in the future. I've got a lot of information to give to you about NC Fast. Things change every day. Fast was a good name for it. because things change very fast from one day to the next. And so I do have a lot of information to give you, so if we could maybe hold questions until I can finish the presentation, I surely would appreciate it. And so the first thing I'm going to be looking at is the strategic plan that we developed. The NC Fast Management Advisor Committee was put in, made part of their, first part of their agenda in NC Fast was to put together this implementation plan so we could, know exactly what their goals were, what the objectives were, what the strategies were that we were going to use to have a successful rollout of family and children's Medicaid, Work First, refugee assistance, all of the Medicaid programs into NC Fast. And so our primary goal was that we were going to have accurate and timely benefits delivered before, during, and after NC Fast implementation for Medicaid. That's the overarching goal. This plan is meant to be a living document. The objectives and activities that are listed in the document, they can be added as needs arise. They can be changed as those needs arise. Changes can be made to the established timeframes if needed to accommodate changes that come from Raleigh. Because, like I said when I began, they are happening very quickly now. And we need to adjust quickly to make sure that the overall goal of accurate and timely benefits is still kept at the forefront. This plan was designed to be shared with the county management, the DSS board members, state liaisons, and staff with clear, understandable goals by all parties. Now, we established 8 objectives within the strategic plan. The first one is to create a work environment which effectively combines the skills and abilities of the staff with the technology of NC Fast. NC Fast is a technology-based program. It's like nothing we have ever seen before. It's not a change, it's not a revision, it's brand new. So we're not adding something to the original, the technology we have now. The technology we have now goes away and is replaced by NC Fast, okay? And it is designed so that the when we're looking at combining and using the skills and abilities of our staff with the technology of NC Fast, we want to design the organization so that the workload can be managed effectively within NC Fast, to ensure the workloads are equitably divided, make certain that NC Fast work model is followed when planning for eligibility functions. We can't hold on to the old ways of thinking how work is done. You have to think when you're doing the planning, as you're going into things, this is how this function is completed in NC Fast. How are we going to get our staff to be able to do this function? I heard somebody say the other day, to work the machine. We have to be able to work this machine to have the output and outcomes that we're desiring. So again, that's one of our first objectives, is to create that environment that we combine the technology of NC Fast with the skills and abilities of our existing staff. Okay. The second objective was to provide education and training to the staff and stakeholders to ensure awareness and usage of NC Fast functions. So within this, we are going to, of course, provide training on NC Fast functions, provide training to staff that is focusing on what is common between the policies and the programs, provide educational materials and forms for clientele, medical providers, and the community. And then, of course, maintain. This is not a one-time thing. By the end of the year, we're done with NC Fast. No, this is an ongoing piece. We're going to have to provide training for, of course, new staff that comes on, and we're going to have remedial training as we go through. But training is for all the stakeholders involved with NC Fast, including the clientele that we're dealing with. It's not just the staff, it's not just the DSS board, it's not just the county management, even the medical providers. It's all of that, including the clientele that we're dealing with. The next objective was to ensure critical case information entered and stored in the current computer systems are accurate and current. Remember, I said that those systems are going away. But the information that's in there has to be accurate as NC Fast comes on so that the transition is as seamless as possible. And so we have implemented a plan to catch up all the overdue work in the programs. We're ensuring that at least 98% of all overdue reviews are completed by June 30th, 2013. And we're going to analyze data which can affect eligibility to ensure accuracy in the computer system. There are many times in the past where simple things like a race code or an ethnicity code could be off, could be wrong, and it would spit out a report that would take us a number of days to complete to correct the data. Well, we want to make sure that data is right now. We don't want to wait till it gets into NC Fast and then could cause us more work. The next objective is to provide timely and accurate data regarding technology requirements and foster communication with technology providers. We want to maintain an open line of communication with MIS. We want to ensure that all needs regarding the system requirements are shared with our MIS liaison. And we want to plan for and request the needed hardware in a timely manner to keep the processes moving without delay. This obviously, NC Fast is technology driven. Scanners, bandwidth. I've learned so much about this type of technology since coming on with NC Fast. And so, we want to make sure that we have open lines of communication with MIS and that we can understand what they're saying to us in the language that they speak. And that does actually take some talent. Because to a certain extent, sometimes we feel like we're speaking two different languages. And so to make sure they understand our needs and that they're understanding what we're talking about and that we understand what they can provide us. Creating a filing system for our current and future paper files which supports easy access to information and the universal worker model. We need to propose and design to combine the existing paper file systems into one universal case file and maintain this system. And then plan and budget for needed storage capacity to house closed files. Because we have thousands upon thousands of files, taking up many, many rooms of storage over at the Human Services Center. And so one of the objectives is to make a plan, come up with a plan that where we can combine these files, just like the universal worker is doing all programs, combine the files and then make sure that we have the storage capacity to house them off-site, the budgetary funds to house them off-site, or whatever the plan may be to move these files and make sure that we have access to the information in the future if we need it. Use the resources of NC Fast to state reporting and state reporting systems to ensure the workload is being managed effectively. Ensure management has permissions to assess reporting systems and training to interpret data. Use data to assure workload is evenly distributed and the current structure is meeting the needs of the clientele in the agency. And monitor the data to ensure the staff are progressing in their use of NC Fast functions. What the state is moving from, again, they're closing down one data system and moving to another type of data system. We have to make sure the management has access to the reports that are going to be generated within this system and that they have training to be able to retrieve and interpret what they're getting back. And then apply this to the staff to make sure that they are progressing as far as NC Fast is concerned and that the workload is being divided equitably, that the work is getting done in an efficient manner. Research and develop new techniques to effectively manage the workload within the NC Fast system. Provide training on new procedures to assure supervisors have the skills needed to manage in the new environment. Analyze skills and abilities needed to perform duties in relation to new hires. Develop new evaluation tools to capture performance of staff. This is, NC Fast is, and the management, as a supervisor, the management of workers and workloads in NC Fast is totally different than it is currently. So not only are your workers learning new systems and new ways of doing the work and getting the product out, the supervisors have to learn new ways of managing that. They have to adapt their skills and abilities to an NC Fast management environment. We also are going to need to look at the skills and abilities that we are needing from new hires to ensure that we are able to maintain and use NC Fast to the abilities that we need to do. And so we also then, when we're looking at evaluating workers and evaluating workloads, we're going to need to look at new tools as well to make sure that we're capturing what we need to make sure that the workers are doing the job effectively. And we need to ensure open lines of communication between all parties affected by the change to NC Fast. We design and adhere to a communication chain to ensure everyone is kept informed of plans and changes that come about. Ensure information is designed in a user-friendly way. Use varying types of resources to publish information, for example, email, newsletters, the county website, public information office. Think outside the box and trying to make sure, especially the clientele and the medical providers are aware, in the community, are aware of the changes with NC Fast and how it's going to affect them. And part of this, trying to make sure that we keep those lines of communication open, you'll notice today you were provided with an NC Fast handbook, the board members were. Inside that handbook is copies of the strategic plan, copies of the update, which Mr. Averett's going to do, and some other information that I thought might be pertinent to NC Fast. And we're hoping that you'll use that to, as we go forward, as information is sent to you about NC Fast, you'll be able to put it in the notebook, and it's going to become a comprehensive plan. You'll have the plan right at your hand, and you'll be able to understand NC Fast just as well as anyone does, which right now might not be very well because we're all a little confused about it. Well, some of the things we've accomplished so far. We've established the NC Fast implementation team and subcommittees. We've got every Wednesday the implementation team meets, and we have a staffing team and a training team subcommittee underneath that. We've established the NC Fast Management Advisory Committee, which is made up of the management team and the county champions. We began using the reception functionality of NC Fast on March 1st for food nutrition services. So when you come in for food nutrition services, it starts in the NC Fast reception piece. From head to toe, it's in NC Fast. We've developed a reorganizational model based upon the universal worker and task model in NC Fast. And a copy of that is in your handbook under the charts tab, where it shows you what the reorganizational model is over at the Human Services Center. Some of the team has visited Johnston County and networked with other counties at the Leadership Summit to share ideas. There was a leadership summit in April in Raleigh, and all 100 counties were there. And you were able to network with all these people, supervisors as yourself, and get ideas as to how they were doing and how you were doing. Some are very much ahead of what we might be doing. Some are behind. So it was very, very interesting to hear where everybody was in coming into NC Fast. And then we have reorganized the food nutrition services section into intake review units, and we've moved them into the NC Fast task model, and to assist with overdue review and to assist with the overdue workload. We have mandated that Medicaid staff view the first web-based training courses related to NC Fast, and they did that in March. We began the overdue project on April 5th, 2013, focusing on reducing the number of overdue cases in all programs. We've scheduled our first in-service training with Carolina Pregnancy Center, and that is on May 22nd, 2013. And then we have developed the strategic plan to guide the agency through the implementation of NC Fast. And now Mr. Ava is going to give you the project update.
Thank you. The implementation timeline for NC Fast in that with Medicaid and Work First, we've already been notified that our date of beginning our soft launch is August 19th. And the soft launch is when we move to taking applications in the NC Fast system. Our hard launch will be sometime in November of 2013. The hard launch is when all actions are done, including recertifications or reviews of cases are done at that time. Now, we learned a lot about the Affordable Care Act and what impact the Affordable Care Act will have on NC Fast and our process. On October 1st of this year, all applications through the Affordable Care Act marketplace that would come to us for people who are potentially eligible for Medicaid will come to us beginning October 1st. Clients that are receiving coverage through the Affordable Care Act would begin January 1st. Of course, we've talked previously about the fact that the North Carolina legislature opted not to expand Medicaid coverage to citizens with income below 100 at and below 133% poverty level. What that means is that people below 134% of poverty and at and above 100% of poverty will not receive any type of assistance through the Affordable Care Act. They would have to be evaluated under the existing Medicaid rules that are in place now. And in this lower income group, we've been told at the summit we attended in Raleigh that the Affordable Care Act is available and the marketplace where they would search for coverage, but there would be no government assistance with purchasing that kind of insurance through the marketplace. So the same rules would apply as apply for Medicaid. If an individual could meet a deductible, if an individual meets a disability requirement of Medicaid, then they would still potentially be eligible, but there's nothing for this segment of the population through the Affordable Care Act. And it's just really important that everybody understands that Medicaid rules as they exist now would be the only option for people in that part of the population. There is no wrong door. We can refer people to the marketplace, or we can receive applications for people potentially eligible for Medicaid through the marketplace website. When we are conducting our reviews on our Medicaid cases, we would conduct reviews done by electronic verifications that we can access. The only time clients would be asked to provide information in a review situation is if we cannot verify the information needed and we do not already have access to it. We would be using the adjusted gross income figures, and we'll receive more information on that later through IRS. So there will be a link that the income verification will come from the Internal Revenue Service. That's going to be for the Medicaid program. Children who have previously been in foster care would be able to receive medical assistance up to age 26. That's another change of that the Affordable Care Act brings. And in the MAF, or Medical Assistance to Families program under Family and Children's Medicaid, there will no longer be a reserve test or reserve like bank accounts, additional property, anything that would have a value that could be converted into money. That test would not be a part of that program anymore. That's going away. EPASS is another component of NC Fast, and EPASS is a website that individuals can make application, and we can receive those applications electronically. Now, for food and nutrition services, That was rolled out so that all 100 counties could accept applications beginning April 22nd. To date, and I checked today, we have received 20 applications for food and nutrition services through ePass. So some people are becoming familiar with it, are becoming aware that it's there. And this is the first time that an application could actually be done electronically without having to actually print it out and then mail it in or bring it by. So this is completely, and the signature, the person verifies that they're the one signing off on the application. It's all done electronically. And anything that's filed before 2 o'clock in the afternoon would be considered received that day. Anything after 2 would be considered received the next day. And each day, a supervisor checks the ePass component to see if we have any applications there. Ms. Ravilla mentioned earlier about training that will be required and necessary for implementation of Project 2 and 6. And 20 hours of web-based training will have to be completed by employees before they can attend classroom training. Training will be conducted at the Human Services Center by the state between August 5th and August 23rd. We are a regional site for training, but what's nice about this is it's right there in our building, so it'll be very convenient that all of our staff will be able to have this training locally. Everybody receives 2.5 days of classroom training, followed by over-the-shoulder support, which is offered by the state of North Carolina. Once the training is concluded, then people who are proficient in using the program are here to help, to move around among the employees and help them navigate the system. The workers who are working in food and nutrition services now will also attend this training because this is a further implementation, and at one point all the programs will be folded into one, so that's why they'll also need this training. On April 22nd and 23rd, Mrs. Ravilla, Ms. Teresa Sampson, who is our Work Support Strategies County representative, and she's an adult Medicaid supervisor, and I attended the Leadership Summit in Raleigh. And the sessions dealt with the Affordable Care Act, how to conduct our business process, how we organize our units, how assignments are given. We received information on competency-based hiring, and the main focus is that new hires should be proficient in using and be able to navigate web-based applications. And I do know we have somebody that will be joining us soon that has worked in the loan area of banking, and part of that individual's job is using something similar to process loan applications that can come from anywhere in the country. So this is good. It's not NC Fast, but it's a similar process, a similar background, and we're looking for that. And then the last session included time frames, training schedules, and updates on readiness activities. Project 3 would be the next project that would be implemented, and that is scheduled for the fall of 2014. They are going to start working on the functionality of it this fall, but it's not expected to be implemented until the fall of 2014. That's our energy programs, crisis intervention program, low-income energy assistance program, and the child care or daycare program for children. Those are scheduled fall of 2014. Because the Affordable Care Act is effective October 1st, that has caused a delay for implementation of energy programs and child care. There are a couple of things in concluding that I just wanted to mention. First of all, I'm very thankful to how all the staff have worked together, the supervisors, the implementation committee that's been formed, the management team have all been involved in this process, and we have involved the caseworkers in the process as we had indicated we would. We have developed our organizational model, how we're going to process the work, how the units are divided into areas of functionality, and that is in the handbook, that organizational chart. We surveyed caseworkers and asked them what their preferences are as far as what their first preference would be for an assignment in the new process. We asked them what areas they felt like they needed additional training in, areas they felt like they could improve, needed to work on. And as all of the employees have been notified of what their assignment's going to be, they also now know whom their supervisor will be when we move to the new model. The feedback that we have gotten from staff, the supervisors and I, about how we have included them in that process, and the fact that they already know what their assignments are going to be and have time to adjust to that, and knowing that there will be, in some cases, some people will have supervisor changes, but not all of the caseworkers. We're very pleased with how that's gone. And when we had our foundation workshop, which was held here in Pitt County, we were asked by other counties, we shared this information, the fact about how we surveyed the staff, and several of them asked us to share that survey tool that our committee developed, and we've done that. And I know I've had contact with one county they're going to take that survey tool and use it to proceed with how they work on their assignments. So I just wanted to say thank you, and we're really pleased. A lot of work has been done in a short period of time. Thank you.
If you'd stay there, we may have some questions.
Okay.
Okay, Charlie? I guess one thing that if I'm reflecting back on the board, these are some of the things that we had wanted, I would think, and a more detailed idea of the things that you're doing, and a plan that we can see. I certainly see the amount of work, and we really appreciate it, because I think that was some of our concerns, quite frankly, that we were not sure what was going on in some of the things that were being done. I had a couple of questions, I guess, on page 23. We talked about the soft and hard launch. The soft launch, that means you get your applications in, and then you have until the hard launch to start working on it, or what?
Now, we actually began August 19th. All applications from that point forward will be done in the system.
Okay.
Then soft launch, reviews on cases, cases that come up for reviews, and any changes made to cases, that would be added on in November.
Okay.
Hard launch, yes.
Okay. And you talk about create a filing system for our current and future paper files. For me, that's a significant issue. I'm glad you're addressing it. Have you considered scanning those things in?
That is something that will be coming later with NC-FAST. That is part of our plan to move toward that. And it's because that is part of NC-FAST, there's no reimbursement for going out on your own and getting any kind of process. So if we move along with the NC-FAST plan, then we would provide the scanners and the hardware, but the scanning part will eventually be implemented in NC-FAST.
Now, and once that's scanned, as an example, if we ask for X, Y, and Z data from the old people, you'll be able to access that and give us a report on it? So
okay.
we have all these old files. Now, it's in the computer and scanned, but suppose we want information from those old files.
From the old cases, the NC-FAST begins at this point, the point of implementation, and moves forward. Everything from here forward would be scanned, but it does not include going back and scanning all the old stuff. At a certain point, the old stuff is no longer needed once you move forward, so not a lot of effort or money is put into doing the old stuff. We maintain it as long as we have to. There's a retention schedule for food and nutrition services. Eventually, those records can be destroyed. We don't have to keep them in.
That's what she said in the beginning. We're going into a new system.
Correct.
completely, and you
That's
don't know
correct.
about it.
That's
All right.
correct. We
Now,
move forward.
And under accomplishments thus far, and that's on page 22, last one, for the staffing team and training team, would that be open to us as board members?
If any of you would like to join us, we'll let you know. If you just
Okay.
communicate that to us, and we'll let you know.
It's to be completed. That's what I took notice of. 98% of it.
Correct.
And that's to be done by,
June 30th, right?
right, and that's shortcoming.
Right, yeah.
So that's what I think the goal that we need to take and be looking at.
Yes.
And I hope
Yeah.
that you're working with the county and so forth to make sure that this,
We had a meeting on Friday, an emergency meeting of the NC Fast implementation team on Friday.
yeah,
It wasn't able to be put in your packets because it had already been printed. And the Medicaid supervisors, the food stamp supervisors, administrator, we all sat down and we
Good.
all made, what we did was we basically broke down the process right now that Food Nutrition Services is having to do with all their different actions.
good.
And we identified those pieces within the process that people who don't know anything about Food Nutrition Services can do. Things like pull files, run onlines into the inquiries like the Social Security system, that type of thing. You don't have to know the program-specific policies to be able to do those kind of things. So we did that. We've taken responsibility. The other Medicaid supervisors have taken responsibility to ensure that those things are done to help the Food Nutrition Services piece and with the overdue reviews. And we've also are going to start training Medicaid workers to do the food stamp piece that's slowing everything down, because they can be trained to do that. And that training starts this week, I believe. There's 2
Yes.
sessions this week. And so they're going to be doing that. And we're also, effective today, we are setting up a customer care type of unit already, where we're going to have 4 workers that are going to handle, all they're going to do is handle food stamp phone calls, food nutrition phone calls, food nutrition walk-ins, to make, and then that way the workers can have time to process the information.
You had the food stamps first, then your Medicaid. All right, are you through now completely with the food stamps?
Overdue?
Yeah.
No, sir.
When,
Everything is supposed to be done by June 30th.
The Medicaid areas were not as far behind, so
That's the food.
So because they're up with what they had to accomplish, they're able now to assist with food and
yeah,
nutrition
well, that's
services.
what, before when we were talking about this, that's what we
Yes,
said
yes.
too, Brian, that they would be able to help
And
these
they,
others.
and they are.
I think the most important piece for the supervisors is, we have, as Medicaid supervisors, we have said, this is one project now. This is NC Fast, we're NC Fast, and we're going to do what we need to do, no matter what the program is, to make sure that everything gets done. And then that is proactively, we're trying to demonstrate, of course, that behavior to the staff that's underneath us. So that'll be one other piece of
I've been
getting remembered.
hearing about NC Fast for some time going, since they forced me to go to Burlington.
Right.
And so I'm seeing something physical that I have heard over more than a year and a half now. So it means that at least we're getting next to something.
And you should see, as we move along like this month, you're going to see additions to the strategic plan as we make new goals. And as we reach a goal, and that goal is finished, then we'll be updating the strategic plan through, and this is all done on the Management Advisory Committee level. And then the Management Advisory Committee, once I get permission from them, then I'll forward that to you so you can put it in your handbook.
I can speak for one person. This is the clearest of how complicated NC Fast has been that I've understood yet, and I do appreciate such an annual and all of that.
I would like to receive an email on the training, because as I'm somewhere else representing, at least I know what's going on. I won't be completely in the
Okay.
dark. I would appreciate the emails, and I'd like to thank you, Susan, for the emails I've gotten, because in the past I was left out of that loop. And so I appreciate getting the emails from this board now.
And again, this is the kind of things that we want. One other thing, and Charlie, you were the champion of this. How are you handling complaints about this system that you might be getting?
Complaints about the slowness of the processing.
Sure, if someone is not happy with this,
The
people
complaints are
calling in.
about service
Right,
complaints.
service
related.
complaints.
Right.
And
Right.
maybe it's a reminder to us, if I understood right, that part of NC Fast, he's probably asking, is that on track? Because we were told that NC Fast would begin to answer this and would help give data.
Well, how are we responding when people call?
Responding and maybe tracking, because we want to be sure that if there's an issue, that we can identify.
Yes, I understand what you're saying. When we find there is an issue with it, we can deal with that issue with the state help desk. Then when they tell us what the problem is disseminated to all of the staff so that we don't have the same issue with each individual worker. It's being distributed to everybody. And the people that have been here with the over-the-shoulder support, there are 3 of them still here with us, they are helping us with that.
Okay. As the great philosopher Mary says, I want to see the numbers. And and that's reasonable.
Right.
You know, like 40, 50, and you'll be able to give us that number. Okay.
I want to make sure I'm
Actual
understanding.
numbers.
Are you discussing the problems within NC Fast itself?
No.
The program or the complaints the clients
So
might
like
have?
if a client complains about, well, you know, I did this stuff and it's not working right.
The number one focus when I first brought that up, and pardon me for interrupting, but was client complaint
Complaints.
and how we track that. And then obviously our plans of responding. But client complaints, whether it is I can't talk to anybody on the phone or, you know, I can't get to my person or I didn't get a timely, whatever, but client complaints, that's where that focus was.
With
I
the
can't read
implementation,
percentages. I can't read percentages.
with going with the customer care unit now and we're taking those 4 workers and reassign them effective today. Now, it's going to take us this week to work everything
Okay.
out, obviously, but with that, they're going to man all those calls. So you're able
And they're
to-
going to keep a list of the types.
That's something
Okay.
that we could probably look
Sure.
into, yeah.
Yeah,
I mean,
we'd
I
like
think
that.
that was
We can
initially
just
part
keep
of the
them.
thought, but that's something that we could look into. But I do want to share with you that last week, one of the main people from Raleigh, Dean Simpson, came down here about NC Fast, and she talked to us. And she said, because I told her how I thought our clientele have just been exemplary in handling all this, and she even said that even though there are some complaints about Pitt County to Raleigh, there are far fewer than many other counties.
Okay.
And I thought that was wonderful.
Sure.
And I think that speaks a lot for the clientele, I do, and so that was just wonderful.
And that's, and we really appreciate that. And I wanted to send you some kudos in terms of that the survey tool you used is going to be adopted by other counties
Yes.
to make these same kinds of decisions, which means it must have been fairly good. A lot of the other counties saw something really useful in what you had completed.
Thank you.
I would like to compliment Mary Ravilla and the amount of work and effort that she has put in to designing all of this.
Yeah.
Quite good.
She was the lead person. wasn't she?
Yes, she was.
She is.
I
And
heard about
she
that
took
at
it
the
and ran
regional,
with
about how important the lead person is.
She is.
And
Yeah.
I want you to know that I don't understand percentages when I don't know the whole. So this is why I asked for the numbers.
And we really appreciate this because, as Charlie said, this is the clearest we've understood this complicated procedure.
It is very complicated.
And if I could also thank Connie Lanier and Donna Causey for the effort and the work that they have put into it to make this transition possible.
Yeah. This is a very difficult process, and we've been hearing about it for, it seems like years, or at least a long time. So we really appreciate your effort. The other thing that we appreciate is the fact
The
that
notebook.
the notebook, and that you're willing to stand up there and take questions from us and present your material. So we do appreciate that.
Thank you.
And as Mary said, the notebook. Must be a librarian thing.
Bring your notebook to every meeting.
Okay. And
You
bring-
know I will. It's going with me to Burlington on Friday, so that you all know there is a meeting Friday in Burlington.
You gonna bring me something back?
Uh-uh.
Okay. Okay. Next, we're gonna go to the DSS project updates, and that'll be by Gwendolyn Burns.
You have before you the technology report for our technology project team. As you can see, we have 8 ongoing projects with this team. I'd like to say, and I think Ms. Revilla has said this more than once, technology in our agency is not up to where it needs to be and where it is in a lot of other agencies. We currently, if we have a project ongoing, we develop the software for that project. We are not purchasing software for any project that we do. And so we are kind of behind in how we are addressing our technology needs here at the agency. We have the 8 ongoing projects, and I have, as a team, we've tried to prioritize those projects and to get things in place with the projects as much as possible. We have WeServe, which is a customer concern project. We don't really want to use the word complaint, but that is our #1 project right now that we're working on. Now, this project will also track positives as well as complaints with this project, and that is one of the things that we changed at our last meeting, that we also want to track the positive things that are going on that clients may call in about, because we do get compliments also for jobs well done. So we are almost ready to present the prototype testing for this project. Now, what's going to happen with this project is that because supervisors are going to be involved in logging in the customer concerns, this has to be tested with our supervisory group before we move on with the process. So we have had some glitches in the system with coding of the different applications, but I'm told that most of that is worked out now and that we should be moving forward. Communicator is our project that handles shelter duty and emergencies, and we have at this point entered all of the contact information for DSS employees in the system, and we're ready for testing on that project also. The CPS note card system, if the board will remember back when we talked about the fatality reviews in closed session and the fact that we needed to link our family data to link extended families with biological families around protection issues with Child Protective Services. That is why that is our #3 project right now, to instead of using the note cards to document our family histories, we are moving toward trying to make that system electronic. We're also looking at some GIS mapping to look at where social workers are actually doing their field work and where they may be moving from one side of the county to the other to see their families, looking at grouping them so that they won't have to travel so far from one place to the other while they're doing their work in terms of assigning cases. That will alleviate so much travel for them. The next project was the Northwoods And that's advanced imaging systems. We were talking about, Dr. Hamilton, you had mentioned, were we looking at any other means of scanning records? These are two companies that we have met with face-to-face about scanning of records to assist with that. What we have found, but we still need to discuss it as a group, is that the cost of scanning records is beyond what we are probably capable of doing right now. And as Brian mentioned, NC does have a means of scanning records that is going to be coming to us in the future. So it's a matter of deciding, which we will probably have to wait on NC because of the cost of scanning records. But we have visited a company in Pineville, North Carolina, and seen where they are storing records, scanning records, and just how their operation worked. And then Northwoods came to us and presented us their process around scanning of records, and they're going to be doing a analysis.
We've submitted, they agreed to do pretty much a free analysis right now. We've submitted to them things like the square footage of this building and the building across the river and the numbers of cases and number of workers. I mean, just all kinds of information. We would like to see a cost analysis, for example. What would 2-3 years look like if we did nothing, and what it would look like, if we began implementing some things, a cost reduction type of thing. But it's a place to start, to help paint the picture of our situation with paper and all of that.
Because we know with NC with the other areas that have to come into NC it's going to be years before we get to child welfare. And we're talking about 2015, 2016 by the time all of the other divisions come into NC
Well, our bigger problem is, like Mary said, we have acres of Medicaid and food stamp records. As my mother would say, under the bed and behind the dresser.
Did I understand you to say you have to wait on NC
for certain
For
parts of.
For document management.
document management piece of it is not up and running yet. And we have certain records in the agency that can never be destroyed, that will have to be scanned, like adoption records and those kinds of things. They cannot be destroyed. Then we have the front desk document management analysis, which is on hold because of NC right now. Where the document management piece of NC is not up and running yet. And then number 7 is our check-in, check-out process, which is what we use it to log in our time in and out of the agency. Now, we've completed the first phase of that, and we are currently using our check-in, check-out system. But in June, we will take a look at what issues folks may have with the system and look at ways of doing things better or resolving any issues we have with the check-in, check-out system at that time. And then number 8, we have the document management scanning of court orders and court reports. That's on hold also with NC right now, waiting to see what will happen with that. But those are the 8 projects that we have ongoing with our technology team right now.
Okay. I think you had mentioned, Mary. She had shared something that the percentages indicate the amount completed.
Yes.
But we were talking about the number, and some of them maybe you can't quantify.
No, can't quantify with numbers
Okay.
at this time. I would like to ask the board if you would take under consideration, because we move so slowly with developing our technology, that you would consider this report being a quarterly report instead of every 30 days, because there's not going to be a whole lot accomplished in 30 days.
My concern is with it being quarterly, is that it, for myself, make it lost in the shuffle. And it, from my standpoint, it helps to know on a monthly basis where we are with these kinds of things, what's going on, what kinds of things can we do. And I'm speaking for myself. How about the other board members? How are you feeling?
I had a question, and then I'll offer a comment on that. When you said we have to develop it, and you spoke about how we were sort of behind with our technology and IT, and we've heard there's a gentleman that's working on parts of these programs, and when we read this report, if I read it correctly, it still kind of leaves it out in limbo, and obviously hard to put a percentage, where are you complete on it, if it's just hanging out there. Are you talking about your own staff has to develop the
No,
program, or our IS here?
MIS.
Okay, MIS here.
Yes.
All right. It would seem to me, and I'll soon be off, but it would seem to me that a quarterly lets an awful lot of time go by for the amount of time that we've got before some of these deadlines come up. Bi-monthly might be, it gives you not just reporting if it's the same thing, but yet it keeps current enough. Now, that's just one opinion. I leave it
I
to
agree
you
that
all.
even if nothing changes, at least it's covering everybody and what you're doing on a monthly basis.
But if we've been 1/6 of a year bi-monthly, and let's just say that our next report would read that, well, we don't know, MIS is unable to give new projected due date, and there are glitches. Let's just say that it does that. That doesn't mean you all impose
Right.
those, but then it is time for Mr. James, it is time for the people downstairs, it is time for the board to be on record to the county manager, obviously through Mr. Perry and those, but with board support, that we have got to have help, or these guidelines are coming on to us. And I guess it's that way that I might, just for my own self,
I agree with you.
bi-monthly still keeps it at focus.
It seems like we're looking at bi-monthly. Is that what we're thinking? And I think we can take a vote. We have a quorum?
Yeah.
No? Okay. All right, well, I'd like to hear a motion.
I make a motion that we allow a bi-monthly report to replace this monthly report.
And I'll second that.
Okay, motion has been made and seconded that the technology report for the DS board meeting become bi-monthly, and that would mean the next one would be due in July. Okay. All those in favor say aye.
Aye.
Aye. All those opposed? Okay. All right, so we'll go to bi-monthly. Okay. Next, we go to the budget update.
You have a letter in your package that was sent to the county manager when we redid our budget,
Mhm.
when we had to update it. If you'll recall, last month, I told you that we were asking for county dollars, an increase of $653,000, which was a 7.5% increase. And what that did was it identified all of the things that we felt we really needed. But when we went back with the county manager, he asked us to go back and relook at what was the least amount of things that we could do. And so our new budget contains that. I want to tell you, starting right out, though, nothing that we've done so far includes anything that's going to happen because of sequestration, because as of right today, we don't have any real guidance as to what sequestration is going to do to us. We've heard that it's going to probably reduce daycare funding, which is federal funding. I know that it's already reduced social services block grant funding, at least it's projected in our, what we refer to as February number. So there's probably going to be some issues with sequestration, but I don't know what they are right now, so we couldn't really account for it. So what we did was we went back and we re-looked at our budget, and we were very fortunate in keeping in our budget 6 temporary staff for 5 months for the low-energy income assistance program. If you will recall, this year we had like $509,000 of money to go directly to clients, and we had 3 workers to do that. Next year, they're projecting that we're going to have over $1 million to be dispersed in this same amount of time, 5 months, and so we needed more workers to get the money out within that time. And we were very fortunate. We were able to, the county, it appears if the commissioners approve our budget as been presented the second time, we will in fact get those temporary staff. In addition, we had asked in our original budget for 8 temporary staff to help with the NC FAST implementation of Medicaid for 12 months. Well, we realized we didn't really need them for 12 months simply because it's not even going to start here in Pitt County until August 18th. So we reduced our request to 10 months. And again, we were very fortunate. We were able to get that funded. It's in our budget. It's in our approved budget that the county manager will be presenting to the commissioners. And Mr. Perry will be presenting to the commissioners tomorrow morning. So that's the only 2 new things that we were able to keep in our budget, but we were pretty happy with that. You'll have another, I left some slides on your desk today to go through. There, I just gave you an updated slide of how our funding looks. We're asking for a total of $29,796,080. That's federal, state, and county dollars. And that's just how it breaks out by administration, services, programs, public assistance, and child support. We are asking, because the temporary staff that we got approved, it actually increased the county cost by $80,442, which was less than a 1% increase in county dollars. And so the county manager indicated that that was where we probably should be. So hopefully, if our budget gets approved at where it's at, we'll end up with $80,000 in additional funding from where we've been. And the last chart I gave you was just one you could look at to show you kind of how our appropriated funding has been going for the last 12, 11 years, something. The yellow bar, or the short bar on there, is your county dollars. And as you can see, our county dollars have stayed pretty steady the last three or 4 years. It hasn't gone up hardly any at all. But anyway, we feel like that this budget, if it gets approved the second way we've done it this time, we feel like we'll be able to operate with it. Of course, it will not be anything that we can go out and do anything extra, but we can pay our current bills is how we feel with this budget. Do you have any questions about it?
Yeah, with remove the projected cost for child support
Yes, sir.
fees, is that, so this is with the new fees that
Yes.
would be enacted for filing court documents,
Yes,
things
sir.
of that nature?
Right. Yes, sir. The county manager felt that since it was, and the budget and the finance officer, since that was a bill in, that hadn't passed at this particular time, he wanted to go, take it out of the budget and leave what we know for sure is an actual thing, not bet on the come, as the saying goes. But he is aware that if the bill does get passed, then he'll have to go back and relook at the funding because we wouldn't be able to support it if.
Because my understanding was the bill had been passed, but it's not been.
No, it has not been passed.
Okay.
Last time I heard, it was still in committee, but I do know that the County Commissioners Association, the Directors Association, a lot of people are lobbying against it, and so we'll see how it comes out.
All right. And the fraud position was eliminated.
Yes, sir.
How is that going to affect our investigations, because they seem a little slow?
We will not be able to move forward with our Medicaid investigation. Our board list this much shows more activity in food and nutrition service, but we're waiting on a letter to come from Division of Health and Human Services, which will identify the program in Medicaid. So we have not received that letter. So the county manager is is waiting on us receiving a letter before he moves forward with it.
Okay. And I certainly have issues with the vehicles being removed because I know a lot of employees are going to be out there riding in cars that may not be safe.
This is not official yet, but what I think the plan is for the county's dollars is to take the vehicle purchases from each one of the departments and put it over in a loan per se for the county. And I believe, and I've not been told anything official, but I believe that we will in fact get some cars.
Okay.
We've just taken them out of our budget and he's put them in a central pot for the whole county.
Okay.
So I think that's going to happen. I don't know how many vehicles we'll get, but I think we're going to get at least one or two.
And I guess the other thing from the board, we had talked about that staff development position. So that's not going to be there at all.
No, sir.
Okay.
Do remember, though, that as they go into NC Fast and get proficient in that, there may be some ways to look at different things with the staff that we currently have to
Okay.
take care of things
Because
as time goes on.
yeah, I guess because what I'm feeling is that was a position that was going to really help out the director in terms of taking a little bit off him, but a person in DSS that has a total view of where we're going, kind of in position-wise and kinds of for each program that can see what this program's doing, what this is doing, and talk with Mr. Perry
Right.
about that, because that's what we were concerned about, that it was in bits and pieces, and he's getting it, but nobody really knew the overall thing, and he was kind of, missing some of that, and that was because he didn't have the staff.
Well, it should come about as time goes on. We will ask for it again next year, as we go.
Okay, and then so we're reduced the foster care payment projections.
Yes, sir. What I did with that was the state provides us with a foster care budgeting template that does a lot of magic arithmetic behind it by keying in the staff. And we budgeted for some extras, but I went back instead of using the state template because it's over $1 million in our budget line items for foster care. And I looked at several years of back data, expenditures, how many kids we had in, what their ages were, and that type of thing. And I think the new dollar that's in this budget is probably closer to what we're actually going to end up spending by the end of the year. But the county manager also is aware that if we in fact continue on the trend that we've had lately of bringing in the teenagers who cost us a lot more than the children, the smaller children, then we may have to revisit this as time goes on. But right now, I think we're okay there.
All right, okay. Sure.
I don't want to hold us up, but as we're all enjoying this good long meeting.
Yeah,
But having said that, would there be, as the reorganizations come and retitling of positions, would you not have staff, older experienced staff that might be candidates for this staff development position because they would understand the new presentations as well as the historical and would know where issues, problems, and all that had been, it would seem to me. Do you foresee having staff that could fill a role like that?
I think so.
Yes.
I really do, as we work through the things, because the current staff we have on board now are coming in with NC Fast at the bottom of it. They're working their way, through it, so they'll be very, very well versed on it. And NC Fast is the top,
future.
what they're going to be looking at. So I think so.
Jackie, do
No
you have
question.
something? Okay. All right. Well, thanks a lot. It's I think this really helps us out, especially in these times of budgetary concerns, and it seems like while we're losing some money, we're not as bad as it might seem, but we're still losing some money.
This is actually a red letter year because this is the first year in the 3 years I've been here that we had a extra dime in county dollars given to us.
The last 3 years we've been reducing position in order to balance our
to
budget.
get our budget to work.
So this is
So we
first
didn't
year.
lose, we didn't lose any positions this year, so that was a good thing.
Good, that sounds good. More people working, doing more stuff, it's a good thing. Okay, next we're gonna go to the director's report.
I'd just like to follow up on the budget update. We will be presenting our budget to the county commissioners tomorrow morning at 8:30. So just want you to be aware of that.
Okay.
And then on the director report, you have the telephone activity report, which shows still an increase in the number of phones coming in through our switchboard and food and nutrition service. So it had dropped off about 16,000 calls from January, but we still plodding heavy. We looked back at it to make sure there was no glitches. We had some problems with making sure that the data was correct. So we're working with Melinda down at MIS to make sure that the information is correct. So that's why we put the April here as opposed to giving it to you in your budget pack to
No.
make sure that the information was correct. The daycare report, we are tracking on that we will be spending within our expenditures. So it looks like when May rolled around payable in June, that we'll be on track to spend the money and have roughly $33,000 left over. So that's good when you look at not making sure our expenditures is in line with what we have budgeted for this year. And then empty fast backlog report. It shows we went in and changed it a little bit just to give you a different viewpoint. We're showing that we have 44 research pending from March, 892 in April, and for the month of May, which we're currently in, we have 2,271 research that are due for this month. We should finish April with the changes that we made. We have, like Miss Mary Revilla told you about, the 4 people that we have during when clients come in through bringing information, that we have 4 additional people handling that. So the staff that's doing research will be mainly doing the research. They would not be interrupted with telephone calls and clients coming in to bring information. Our project goal is to have everything current by June 30th.
Okay.
And we're
On target for that?
we will make it,
Oh, good.
even if we have to.
Even if you have to do something?
Even if I told staff Friday that, based upon what happened in May, personal leave for the month of June will be canceled. So I want people to know that we're serious about getting this done, and that the temporary staff is only here for a short amount of time. June, you own your own. So we need to make sure that by June, we have everything current, ready to go for July. So we're working on that. And project 2 and 6 is just to talk about the soft launch schedule, which shows that we'll be coming on in August the 19th, soft launch, which just be for applications. So between August and the hard launch, our staff will be operating out of 2 different systems. They'll be using NC Fast for the application. They'll be using EIS for research and changes. So they'll be using 2 systems until we go to the hard launch. And once we go to the hard launch, everything will be in NC Fast. So the staff is well aware of that. And this is just pending legislative bills. It shows North Carolina Association of Department of Social Services, County Boards of Social Services, and NCSSA. It shows the pending legislature bills and what our position are on those different bills. So I just figured that was good information for
Sure,
you to have.
sure.
As you hear about different things, you know what the position of the Board of Social Services is, you know what the position of the Directors Association and the NC Social Services Association. So you have all that information there
Okay.
to help you.
And maybe as a board, at some point, we might want to look at those list of legislations and decide maybe on writing a letter or doing something else as we see how those things
Yeah.
affect
Right.
the delivery of services. Okay, and that's it. Okay, well, like to, first you'd have to read the information on closed sessions.
North Carolina General Statute 143-318.11 regarding closed sessions. Section A, permitted purposes. It is the policy of this state that closed sessions shall be held only when required to permit a public body to act in the public interest as permitted in this section. A public body may hold a closed session and exclude the public only when a closed session is required. Also, item number 1, to prevent the disclosure of information that is privileged or confidential pursuant to the law of this state or of the United States, or not considered a public record within the meaning of Chapter 132 of the General Statutes.
I would therefore offer that based on that information, given that we go into closed session to review.
And I second that motion.
Okay. Motion has been made and seconded regarding going into closed session. All those in favor? Aye. All those opposed?